The majority of medical schools in Australia and New Zealand now require you to take an admissions test called the UCAT, formerly known as the UKCAT in the UK. The UCAT, or University Clinical Aptitude Test, is a computer-based aptitude test delivered by Pearson VUE. Testing runs throughout July in Australia and New Zealand. You can only take the test once in a test cycle, i.e., you'll have to wait for next year's application cycle to resit the UCAT. We recommend booking as early as possible because spaces fill up fast. Booking early allows you to get a spot in a preferred test centre. A nearby test centre reduces the risk of being late, missing your test, or, even if you make it in time for the test, being physically exhausted, all of which may affect your performance. You can change the date of your test if you think you aren't ready. Although if you attempt to reschedule your test near the end of the testing period, it's highly unlikely that any places will be left. If you're taking the test in Australia and New Zealand, you will need to take the test in July, ideally during your winter break. We suggest taking this test prior to school starting, in the latter half of July, and giving yourself enough time to practice before sitting. And practice you must. These video tutorials are here to help introduce you to the format, the style of questions, and general advice on the logistics of the day. But practice is the best way to make sure you achieve your best possible score. There is no surefire way to score high in the UCAT. Each individual student has to develop their own technique and engage with the material to get a higher score than being handheld through the process. The UCAT assesses mental faculties deemed essential in the practice of medicine: verbal reasoning, decision-making, quantitative reasoning, abstract reasoning, and situational judgement. What follows is a very brief introduction to the types of questions you will encounter in this test. More detailed introductions to the question types will be dealt with in future tutorials. Each section has their own designated time duration, separated by 1-minute introductions. It is important to note that time spent in each section is limited for that section only. You will not be able to carry over any of the time saved in an earlier section. For example, if you finish VR early, you will not be allowed to carry over the extra time into the next section DM. If you do find yourself having completed all the questions in a section, it is best to utilize all the time left to check your work or any questions you weren't sure about. Once you've ended a section, you cannot go back. The 5 sections follow on from each other sequentially, one after another, until after 120 minutes you'll have finished the test. You will realize that timing is one of the most important factors in the UCAT. We'll discuss this later. The most important factors for now are your technique and familiarity. So, before you concern yourself with timing, let's get you up to speed with what's in the test first. Here we'll introduce you to some important terminology. The questions in the UCAT are structured into question stems. These stems comprise of different things depending on the section. For example, VR stems will consist of passages of text. For QR, charts, tables, etc. Accompanying each stem will be a number of questions. You'll be tasked with using the stem information to answer the question. The number of questions per stem varies, but it is customary for VR to have 11 stems or passages with 4 questions each, and AR to have 5 per stem. But in other sections, the number of questions per stem varies from 1 to 6. The variations will become familiar to you when you practice. VR is the first section of the test. The UCAT administrators state this assesses your ability to read and think carefully about information presented in passages, and to determine whether specific conclusions can be drawn from information presented. This is important because doctors read textbooks, research papers, and clinical protocols. The ability to make inferences, judgments, and conclusions rests on their verbal reasoning ability. So in this section, you will have to answer 44 VR questions, and in 21 minutes. You will encounter 2 question types: reading comprehension and true, false, and can't tell questions. The second section is DM. The UCAT administrators state this assesses your ability to apply logic to reach a decision or conclusion, evaluate arguments, and analyze statistical information. This is important because doctors must make good decisions despite being given complex information, and do so in a timely manner. So in this section, you will have to answer 29 questions in 31 minutes. There are 6 question types named drawing conclusions, logical puzzles, interpreting information, Venn diagrams, evaluating arguments, and probability. A bit of trivia. This section was a fairly new section that was used from 2017 onwards by medical schools in the UK in their assessment of prospective candidates. The next section is QR, the math section. The administrators here state this assesses your ability to solve numerical problems. Proficient data handling is important in medical science for reading and interpreting clinical data. You need not be interested in medical research to appreciate the importance of data handling, but it is still an important skill in the day-to-day medical practice. So in the UCAT, you will have to answer 36 questions in 24 minutes. There are 4 broad question types: algebra, statistics, number, and geometry. The 4th section is AR. The UCAT administrators state this assesses your ability to identify patterns amongst abstract shapes. Many students have historically been bemused with this section's inclusion in the UCAT, but pattern recognition is important in clinical problem-solving activities, i.e., diagnostics. In medicine, symptoms of disease often overlap with one another. Thus, it is an important skill to recognize similarities, but also key differences between diseases, so that one can correctly diagnose their patients. We'll talk a bit more about this in a later tutorial. In this section, you will have to answer 55 questions in 13 minutes. There are 4 question types: set A, B, or neither, complete series, complete statement, and set A or B. The 5th and final section is the SJT. This assesses your ability on interpersonally oriented skills and ethical values, rather than knowledge or clinical skills. This is important because doctors are professionals who must be ethical and be able to work effectively in a team. Scandals have marred the reputation of the medical profession and hospitals in this last decade. The SJT has emerged as a method to assess how individuals should behave in professional environments. So in this test, you will have to answer 69 questions in 26 minutes. There are 2 question types: appropriateness and importance. The remainder of the tutorials will introduce you to the Medify tools for preparing effectively with concise all-you-need-to-know introductions for each of the question types you'll encounter in the test. What's most important is that you start practicing as soon as possible. Developing your technique and familiarity is only possible by practicing in true simulation of the test environment.